And tonight we are taking a look at the opioid overdose deaths in Rock Island County.
Yeah, News 8's Marshawn Gunn joins us live in studio now to explain the changing trend and how the community is fighting substance abuse. Good evening, Marshawn.
Good evening, John and Harrison. 57 people in Rock Island County have died from opioid overdose since 2020. Trends over the last 5 years have gone down slightly, with 5 deaths in 2025 compared to 16 in 2021. I spoke with a behavioral health professional at Unity Point's Robert Young Center about why she thinks the number of deaths is declining. Opioid addiction in the Quad Cities is a consistent issue.
It's a really kind of complicated answer because it's not a one-size-fits-all.
In recent years, the number of opioid deaths per year has gone down.
Especially locally with our prevention efforts with, getting people connected to naloxone, harm reduction efforts, education, being out in the community.
Behavioral health professional lead at the Unity Point Robert Young Center, Amanda Lightfoot, says it's in part because prescription opioids aren't as often prescribed by doctors.
However, there still is illicit fentanyl out there, and we're seeing that in other drugs, essentially. It doesn't even necessarily have to be in an opioid.
For many, it's self-medication that causes overdoses.
They get hurt, they get injured, they're struggling with pain, and they need to get through life. They need to go to work, they have to function, so they start to use pain medications in order to get through that.
That's why Lightfoot says reaching people and making them aware of resources are key.
Harm reduction, getting them connected to peer support, teaching them about naloxone, getting some relapse prevention in there, education.
She says understanding how addiction started helps her connect a person with the services they need.
Why are you using this substance? Is it that you're self-medicating? Is there some co-occurring stuff that's going on? Do we need to get you into mental health?
Often there's more than one contributing factor.
We really have to figure out, well, why are you using the substance? What's going on? Because it's not just about the substance.
She says there's still more work to be done getting help to those suffering from substance abuse. Contributing factors in overdose deaths is stigma against reaching out for help. She says if you are in need of help, there's plenty of resources throughout the community. As I've told you in recent reporting, one thing that's helping is the millions of dollars coming from the Quad Cities from opioid settlement funds. Back to you.